And until you have a system in your practice that's driving that to happen, you aren't going to see the level and the number of referrals that you need. Welcome to AMC. I'm Dr. Greg Miller. Doc, do you ever wish you knew more about why patients do or don't refer? Today I'm going to dive into more detail about why patients refer, and you won't want to miss the insight about the real reason a patient refers. Let's get started. We're going to start by talking about why do patients refer. Doctors, typically I hear one of two things, either because of my great results in practice with my chiropractic care, or oftentimes I'll hear because of my low fees or maybe my family packages or my package fees. So let's unbundle that a little bit. The truth is, patients refer because they like you and because they value and respect what you do for them. It is not because of how much you charge them or how little you charge them, and it is not because of the great results you get. And I know that's hard to hear because we all want to get fantastic results. And doctor, look, I know you do get fantastic results in your practice. But the truth of it is patients refer because, again, they like you and they respect and value the care that you give them. So the question becomes, how do I get them to like me? So the first answer that I have for you in that is a properly done consultation, a properly done exam, and properly done reports. Now, why is this important? Because, look, they have to understand that there's a difference between your office and all the other chiropractic offices that they've been to, or they have to know when they come into your office and they begin coming under your care as a new patient that there's something very, very likable about what I'm doing here, and there's something very, very special about it. And that happens with a properly done CER, consult, examiner, reports. If you don't have that or you don't know what that looks like, please reach out to us. Let us help. We've been doing that for our doctors for a long time. Look, the other thing that's important to understand here is you cannot be, when you're trying to get a patient to like you, you cannot be their best friend. Friendship practices are just a burnout practice waiting to happen. And more importantly than that, they are not a lifetime care practice. They are a pain practice. Patients come in when they hurt, they leave when they quit hurting, and that cycle just continues and it continues and it continues. Doc, I would also ask, if you're likable, you're confident in the care that you give, the concern that you have for your patients, and the seriousness with which you portray that. You have to look back at yourself. You have to get in front of the mirror and look at yourself and ask, am I doing that effectively? A patient will never take their condition more seriously than you do. Listen to me again with that. A patient will never take their condition more seriously than you do. If you're not taking an x-ray to visualize that disc degenerative disease that's happening in their spine, they can't possibly take that condition as seriously as it really is. And doc, if you don't believe that disc degenerative disease is a serious progressive condition, then you need to maybe take another look at what you do as a professional, because that is why we do what we do. Look, when was the last time you heard a new patient say, look, Bill referred me in here because he told me his chiropractor, were a specialist with this condition? Search your mind. Have you heard that? Search your memory. Have you heard that from patients telling you that they heard you were a specialist? If you haven't heard that, then you need to look at this seriousness, this care, and this concern that you have for your patients and their conditions. So there's some thoughts on liking you. We'll talk a little bit more about that with value, but let's talk about that low price thing. It's common for me to hear a doctor tell me that I keep my prices low so my patients will come in, or I have family package fees, or I charge one fee for a month of care. Look, doc, the data proves to us that is just not true. Actually, respect and fee go equally. In other words, if you increase your fees, the data proves to us that you will see an increase in referrals. You're just going to have to trust me on that one, but we have seen it time and time again that is absolutely true. It's why cash offices typically have a higher referral practice than insurance offices. Now, what about your office? When you join AMC, when you become a part of AMC, you have one of the first things we do is an office evaluation. Why do you suppose we do that? Look, we spent 3.5 hours at our last boot camp, our last seminar, Dr. Brubaker and I did, talking about office evaluation. Let me just throw a couple of thoughts out there. Look, again, the goal here is for patients to like us and to respect and value what we do. Does your office speak out value? What are you doing in that office? When they walk through that front door and come up to the reception desk, what do they see? What is their perception? Do that sometime. Put on, the glasses of a new patient and walk into your office. Is the first thing you see ice packs, pillows, and supplements for sale in the waiting room? What does that tell a patient's innate? What is that telling them? It's telling them that, oh man, they're here to sell me something. They're not here about my condition or about my care. And look, you may not like that, but it's true. How about the dress? How about the dress code in your office? What are you wearing? Or what you're wearing speaking out professionalism? Is speaking out that I care about you and your condition? Is your staff dressed in a professional way? Doc, look at those things. See if there may be some truth to that. What about the layout of your office? Does it display success and demand value? Does the flow? When was the last time you took through your office the path that a new patient takes? Sat everywhere a new patient sits? Looked at everything that a new patient looks at? Does it scream value? Does it tell patients that they are in the right place? If you're not sure, again, reach out. Let us help you. That's what we're here to do. What about the doctor's conviction and enthusiasm for chiropractic first? Is this you? Again, doc, you have to search your innate for that. You have to know, am I compassionate about chiropractic? Do I believe that what I do as a chiropractor is changing lives? Okay, so the truth is, we ultimately have to teach our patients to refer. We have to have an expectation of referrals in our office. I remember in my practice, we used to have a banner back in the break room that says, everyone refers one and many refer more. Do you have that kind of an expectation? Do patients just simply know innately that they are expected to refer? If you're not sure about that, then you need to have a system in your practice that helps your entire office do this. And that's what I'm talking about, is not just you as the doctor. That's not just your responsibility. Does your staff understand how to encourage referrals? Do they understand how to have a conversation with the patient about referring their friends and family into the office and why it's important? You have to speak referrals often, and you need to ask for them. Sometimes the solution to getting referrals is the simplest one, and it just means asking for new patients. One last thought. You don't always know what your patients are thinking. As I was preparing this just brief talk for you, I was thinking about back in practice. This is probably 12 or 15 years ago. It was a busy Friday morning in the office, and we were seeing a lot of patients. And I remember this gal, Phyllis. She was sitting in the chair waiting for me, and she had this kind of forlorn look on her face. And I'm like, Phyllis, what's going on? What's wrong? And she said, well, I've been out in the waiting room, and I've just been seeing how busy you are in this practice and how many people are getting better. And I just wish I could refer my sister in for care with you. And I remember it rocked me back on my heels. I said, Phyllis, what do you mean? We absolutely will take care of your sister. Why did you think we wouldn't? And she said, you're just so busy here. I figured you weren't taking new patients. Again, until you ask for them and until you make sure patients understand their responsibility is to refer, and until you have a system in your practice that's driving that to happen, you aren't going to see the level and the number of referrals that you need. If you want to truly grow a maintenance lifetime chiropractic care office where you do someday end up as a waiting list practice, then you've got to have a system that's driving that. You've got to have the office evaluation and layout that way. You've got to have your heart and your innate right, And you've got to make sure your patients like you and they value what you do for them. If you want to learn more about expertly capturing the very best new patients, then let us know. We are here to help. Doc, AMC is your guide to becoming respected, effective, and valued in practice. We know what works, and we prove it with our Grow Guarantee. If we can't help your practice grow, it costs you nothing. Text me at 904-966-4996 for more details. See you next week.